Is your nervous system getting hijacked at work? If you're a nurse and you're working in unsafe conditions, chances are your nervous system, and I mean autonomic nervous system, is getting hijacked at work. So here's the thing. When we start to look at nurse professional well-being in the workplace, and it doesn't matter what type of practice setting you're in, as it turns out, for us to do our jobs, we need to be in what's known as ventral vagal tone. So polyvagal theory was brought forth by Dr. Stephen Porges, and there's three circuits that all mammals, not just nurses, all of us, any mammal, humans notwithstanding, that go on and offline depending upon a number of factors, including what our midbrain, what he calls the threat detector, our kind of innate surveillance system that's working 24/7 to see if our internal and external conditions are safe. And what's happening to millions of nurses is that they're going to the work and their threat detector is like, whoo, whoo, whoo. These are dangerous staffing ratios. These are under-resourced conditions. There is workplace violence, there is bullying, there is lateral violence, there's gaslighting, and all of these are sending signals from the threat detector to the autonomic nervous system that, this nurse is not safe. This nurse is not safe. This nurse is not safe. And what that does is it takes us out of that ventral vagal tone where we feel safe and connected and can really be fully present and heart-centered in our practices, to being in sympathetic overdrive where we are in flight, fight, or fawning responses. And while our anatomy, our physiology is built to do that for short microbursts of stress, we are not built to withstand the chronic, systemic, avoidable nurse-specific trauma exposure that each and every nurse is enduring every day. And it's being marginalized and minimized as just burnout, or you should work on your resilience. Or in a recent American Nurses Association webinar on burnout, that if we just make our beds and have a positivity squad, that everything will be okay. Really? Because I don't know what evidence everybody else is reading over there. That's not the evidence that I'm reading. Of course, I went out of discipline because I'm a total geek. I mean, I'm going to admit this. I should just be waving geek flags because I love nothing more than to read the evidence and really research. Like, I like to scrape the bottom of the evidence bucket. And because I have a background in social and behavioral sciences, I went over there to do the research to find out what I could do to help my profession. And come to find out, polyvagal theory and relational neuroscience and transpersonal neurobiology have a lot of wisdom for us. So please continue to follow me in this series. I will be sure to unpack it, and I have a lot of information on my YouTube podcast channel, so you might also want to check there. From my healer's heart to yours, and until next time, thank you for all that you are and all that you do. Namaste.